April 2024. The Institute of Mental Health received a complaint from a patient who said his personal data was used for a research study without consent. The case involved a research officer obtaining the patient's name and appointment details from his attending doctor, then using this information to locate and approach him in the clinic's waiting area. The patient believed his health information had been disclosed without permission, but the organization explained that only names and appointment times had been shared, not full medical records. The investigation found that IMH had displayed a long-standing notice at high-traffic counters stating that patients' personal data may be used to invite participation in care programs or research. Because this notice had been in place since 2014 and the patient had been visiting the clinic regularly, the Commission determined he had given implied consent by continuing to receive services without objection. However, the Commission also found IMH could not rely on deemed consent by notification because the notice did not explain how patients could opt out or how long they had to do so. IMH was not found in breach of the PDPA as implied consent had been obtained, but the Commission said express consent would have been a better safeguard. The organization has since revised its processes. Now, a patient's care team will first explain the recruitment purpose, and the research officer will seek express consent before proceeding. So, what are the important takeaways? Make privacy notices clear and visible, and explain exactly how individuals can opt out and by when. Whenever sensitive personal data, like medical information, is involved, aim to obtain express consent rather than relying on implied consent. Ensure the frontline staff understands when and how personal data can be used, and keep all recruitment processes transparent to the individuals involved. This case proves that even when consent is technically valid, better communication and clearer processes can protect both organizations and individuals. Stay protected, stay alert. Join us next time on Tales from the Cyberspace.